Today is the last day of school before winter break starts for thousands of kids across the Front Range.
And as we get to the halfway point of the school year, this morning we're taking an in-depth 360 look at the ongoing mental health crisis facing Colorado students. Several districts have sent notices to parents with resources.
First, we look at the state of our hospitals. We hear from a doctor who says there's been an increase in ER visits for mental health reasons.
We'll also look at the factors that are leading to what health professionals are calling a national emergency, as well as what resources and solutions are being provided right here in Colorado.
We have in-depth 360 team coverage this morning. We begin with Denver 7's Veronica ACOSTA at Children's Hospital, Colorado. And Veronica, doctors there are concerned.
They are. Doctors here at Children's say that this spring there was a 73% increase compared to 2019 in the number of children who came to the ER seeking or needing some sort of mental health help. That is exactly why they're calling this a big emergency. So it's something doctors are dealing with every single day. Some days, rather, they say 20% of children in the ER are there for mental health help. Other days, they say that number can be closer to 70%. And these doctors say we're not just talking about teenagers here. They're also seeing kids as young as 5 years old being brought in by their parents or their guardians needing some sort of help. Dr. Jenna Glover, she's a child psychologist here. Before the pandemic, she spent a lot of her time making sure things ran properly. Every now and then she would go down to the ER and help if it was absolutely necessary. But more recently, she says that she's been going down at least twice a week to help whenever there were kids down there. And that's because of staffing shortages. It's during those trips down to the ER that she says she's seen those initial interactions and has had those interactions with children in need.
Kids are coming in feeling completely overwhelmed, having panic attacks, and also just having thoughts of not being able to go on. And so lots of suicidal thoughts and things that we've really never seen before at this level.
So if you're asking yourself this morning, well, what's next or what's the solution? Dr. Glover says she thinks it's all about getting more hands on deck, whether that's inside of schools or even inside of hospitals like the one right here behind me. She also has some advice for parents. She says if you've noticed a significant change in your child's personality, she really urges you seek out your pediatrician and ask them for some help. We're in Aurora this morning. I'm Veronica ACOSTA, Denver 7.
Yeah, great time to just pause and check yourself or your loved ones. All right, thank you, Veronica. It was back in May, Children's Hospital Colorado declared a state of emergency for youth mental health. For perspective on what that declaration means, here's what the CEO of Children's Hospital said back in May.
My hope in declaring this pediatric mental health state of emergency is that the state of Colorado, our community partners, and all of us can come together with a different level of priority focus and a different level of resources to address this crisis.
And since then, Children's Colorado has supported declarations from the American Academy of Pediatrics and other medical groups that kids' mental health is a national emergency.
Just last week, it was the U.S. Surgeon General raising the red flag on kids' mental health. Dr. Vivek Murthy released a 53-page report looking at the leading factors in what he calls devastating mental health effects. Of course, the pandemic plays a big part in this. Remote learning has led to kids feeling disconnected from their classmates, but there are also pressures from the social media culture. The report says pop culture can deplete a child's sense of self-worth.
So what kind of work is being done in our state to help kids in need and let them know things will eventually get better? Well, a new law was passed this year that gives kids free access to mental health care during the pandemic. Denver 7's Nicole Brady continues our in-depth coverage this morning. And Nicole, you dug into the numbers here of how many kids have been helped so far.
Yeah, earlier this year, you may remember the state legislature approved $9 million to provide every youth in Colorado with 3 free counseling sessions. I just found out some 1,500 appointments have been completed or scheduled since the website to access those services went live in late October. Now, this is that website, imattercolorado.org. So if you're a parent watching, remember that website. The state's Deputy Director of Programs for Behavioral Health tells me that in the past 7 weeks, 40 young people have already gone through all 3 of their free sessions. 133 have completed 2 sessions. Most have been via telehealth, but they do hope to increase in-person offerings as well. And the good news is state leaders tell me they have a couple hundred slots available at any given time. So if you signed up today on the iMatter website, you would likely get an appointment quickly. I asked what comes next, though, if 3 sessions aren't enough to address some of our kids' needs.
The advantage of the 3 sessions is that we can help youth develop a relationship with a counselor or a therapist and help them really develop a relationship with mental health care and prioritizing their mental health care throughout their lives. We have developed a set of criteria that really looks at, is there a need for additional sessions, or how can we make sure that these youth are continued to be helped?
And the state does have to give a report to the legislature on this on January 1st. So right now they're gathering demographic data on who exactly is using the services the most. And they want to know if there are any specific groups of kids they should be reaching out to more. They'll also be launching the I Matter website in Spanish soon. Brian.
Some great information. Thank you, Nicole. There's also work being done at the federal level. Right now, there are 2 pieces of legislation in Congress to address the crisis. One would provide money to train more providers. The other would give grants to children's hospitals to beef up their mental health services.
And those services can only be taken advantage of if there are enough mental health specialists and available beds in our state. And at the moment, our state is falling far behind on that part.
Do not have enough beds or enough facilities willing to accept these kids. We have child welfare workers who are staying with kids in hotel rooms while we're waiting to try to find a bed somewhere in Colorado or even somewhere else in the country. That's how much of a shortage we have right now.
And this shortage means therapists at centers are overworked and patients often have to wait weeks for care.
So let's talk solutions and more resources for care. You can dial 211 for help. That system was set up for unemployed Coloradans, but anyone can use it.
When someone calls 211, we will connect with a trained resource navigator who will help navigate what can be a pretty complex landscape of accessible benefits.
So this program is really about acknowledging that we want to help unemployed Coloradans take care of their mental health while they're searching for a job.
Also, don't forget the Colorado Crisis Tip Line. The Colorado Crisis Services Center can help you anytime, day or night. Just call the number right there on your screen and you can talk to someone 24/7.
And we know we just threw a lot of information at you, but this is important for the safety of our kids. And we want to hear from you now. How is your child dealing with the stresses of the pandemic and social media culture? How do you help them cope with mental health struggles? You can send us an email to 360@thedenverchannel.com. We previously went in depth on mental health in Colorado, and you can find our coverage on Denver 7 Plus for your streaming device.